Hi, my name is Karen and I'm an MSW student with the University of North Dakota. I'm here to share a therapeutic technique that can help children learn relaxation breathing that is called bubble breaths. Relaxation breathing is supported by evidence-based literature as being beneficial for mental and physical well-being in children and adults. Relaxation breathing techniques are incorporated in several evidence-based therapy models that are used to treat children who are experiencing a number of difficulties such as anxiety, depression, or anger. Trauma-focused cognitive behavioral therapy and exposure therapy are good examples of treatment modalities that include relaxation technique of deep breathing. Deep breathing exercises are also helpful in pain relief or for pain management of chronic diseases or before and after surgical procedures. Bubble breaths is a very simple and fun technique, and it's inexpensive and portable, so it can be demonstrated to children in most any setting, whether it's a clinical setting or in a child's home or school, and it can be used with individuals or in group therapy. The only supply you need is bubbles. You can use commercial bubbles like these, and you can always refill the bottle with homemade bubbles. I found numerous recipes on the internet for homemade bubbles, so you never have to worry about running out. Bubble breaths is a good strategy to use with young children because the clinician and the child can build rapport by having fun with the bubbles. And this also helps the child become more relaxed and more open to learning the breathing technique. It's suggested that the clinicians start the session by blowing lots of bubbles for the child to chase around and pop. You could have 2 bottles of bubbles and let the child start blowing bubbles with you. Again, this helps build that relaxed rapport with your young client. After a few minutes, ask the child to blow the biggest bubble she can blow. If the child has trouble getting a big bubble, demonstrate how to hold your lips, how to blow softly, and then let her try again. After doing this a couple of times, explain the body mechanics of blowing big bubbles versus blowing small ones. Show the child how to take a deep breath from the diaphragm and how to exhale slowly and softly. You can have the child place their hand on their stomach and feel how it rises and falls with their breaths, explaining that they want their diaphragm to push out and fill up with air that they need to blow a big bubble. Then relate to the child that how they push that air out is how they can blow a great big bubble. Afterwards, you can explain to the child that they can practice bubble breaths even when they don't have any bubbles, or if they have trouble blowing a great big bubble before it pops. Explain that when they feel nervous or scared or angry, that their hearts beat faster and their lungs naturally take short, small breaths, and that they can make them feel even more scared and more angry. But if they take long, slow, deep breaths, like when they blow a large bubble, their heartbeat slows down and they could start to feel more calm. Allow the child to practice blowing more big bubbles, paying attention to their stomach rising for their big breaths in and their stomachs going in when they blow out slowly. Just a couple of helpful hints to keep in mind when you use this technique. Be mindful of the floor surface where you're demonstrating this because you certainly don't want children falling on a slippery floor. And also be sure to open and use your bubbles before trying them with your young client, because as you can see here, the wand that I got with these bubbles has very small openings. When I tried and practiced blowing a bubble, I had a hard time getting a big one as well. So imagine if you have a young child becoming frustrated because they can't blow a large bubble in these small holes. You'll just be defeating the purpose of the entire exercise. Bubble breaths is a play therapy technique that accomplishes a whole lot more than just playing with bubbles. You can teach children about their anatomy and how their body and their mood can be affected by their breathing. And having a concrete concept like blowing a big bubble helps them relate to taking deeper and slower breaths at times when they need to calm themselves down. You could even let the child take the bubbles home when their treatment terminates, as yet another concrete reminder of how to practice their relaxation breathing. I hope you're able to incorporate this fun technique with your work with children. Thank you.